The most common operation for a general surgeon is hernia repair. And the most common location for a hernia is the groin, and most groin hernias are of a particular variety, what we call inguinal hernias. Now, inguinal hernias can occur in both men and women, but they're 10 times more common in men, affecting approximately 1 in 3 men during their lifetime. Now, I've personally performed thousands of inguinal hernia repairs, and I've settled on a technique that I love and I believe my patients appreciate. The goals of the surgery are, number one, to have the best ultimate result in terms of no recurrence of the hernia and no chronic pain syndromes. And secondly, to minimize the recovery, to minimize the pain and minimize the time lost from work and from your life. Surgeons debate about the approach, laparoscopic versus open, but we all agree that the superior repair involves mesh, and ideally placing that mesh posteriorly or beneath the defect. So here's how I do it. In most cases, this surgery is done at our outpatient surgery center, not at the hospital. This is day surgery. You walk in, you walk out, someone drives you back and forth. And you're asleep for the surgery. A general anesthetic is employed. You come in a half an hour before the surgery to get dressed, to get prepared, to get your IV placed, to meet the anesthesiologist and so forth. And then the surgery takes approximately half an hour. And then you're in the recovery room for approximately an hour, sipping on some juice and having a few crackers until your ride arrives. The total time then at the ambulatory surgery center is approximately 2 hours. After you're asleep, we shave and prep the groin, and then I make a horizontal incision 1.5 inches long at around the belt line of the groin. I enter the space above and behind the hernia, and I reduce the herniating material, including the sac, which may contain intestine, from the defect. I create a pocket just the right size, and then I implant the mesh patch in this pocket. And I spend quite a bit of time smoothing down the mesh and getting it in exactly the right position. I use a product called Hernia mesh. It's made in Italy, and in my view, it's the perfect mesh. I can choose from several sizes. The shape and texture are just right. It doesn't shrink. It doesn't weaken with time. And the interstices of the mesh are just the right size to encourage tissue ingrowth. I don't need to fixate the mesh with sutures or staples, which really minimizes the risk of chronic pain. I then close the wound with all absorbable sutures, and there are no stitches to remove. I do not restrict patients at all after this surgery. There's no limit on physical activity or lifting, and returning to work is up to you. I usually do the surgeries on Fridays, and you could go back to work on Monday. Many patients with sedentary jobs do this. Others may opt to take the following week off and go back to work the next Monday. But I really leave this up to the individual. I see patients back 2 weeks post-op. Most patients report that they used a moderate number of pain pills, maybe 8 to 10 pills that weekend. And then they find they don't need them anymore. And they're back to all of their usual activities and are very happy with the result. So again, you want a permanent repair of your hernia, and you don't want any lingering pain. You don't want to think about it again. To get there, unfortunately, requires surgery, but we can minimize the pain and time loss, and that's our goal. So if you've been diagnosed with a hernia and would like more information, just call us or visit our website.